So move that.
I move the report, Chair.
I'll second that report. Councillor Charles.
Thank you, Chair. Before I set out just some of the key highlights from what has been an extensive piece of work, not only by council officers but a range of parties externally who have contributed to it, I just want to say how grateful I was for the pre-group scrutiny session and then the scrutiny committee asking questions about the strategy during an extended session. I think we unearthed some practical things that could be factored into the wider consultation for the strategy. As you will see in the paper itself, the statistics that are born out of the Essex Joint Strategic Needs Assessment are sobering for our town. They cover a range of issues around substance misuse, challenges around physical inactivity, childhood obesity, which has been a trend in the town for some time and needs to be arrested, and wider issues around the socio-economic factors that contribute to people's health and well-being. So as a result of that, the Council has set out some broad strategic themes to measure the performance of how it tackles health and well-being issues in the town. Those three core strategic focus areas in the paper revolve around tackling specific health and well-being inequalities through a partnership approach, of course working with our local health care leaders, Essex County Council, which of course is the primary public health authority, reducing socio-economic determinants contributing to poor health outcomes in the town, and promoting independence and healthy lifestyles at every stage of someone's life. Now, in a departure from the usual way that we have put together these types of strategies, we've mirrored what Essex County Council have done and adopted the Robert Wood-Johnson model for the wider determinants. And the Robert Wood-Johnson model has a range of influencing spheres. So one of them is socio-economic factors, someone's education, someone's income, health barriers, whether alcohol use or smoking is a factor, clinical care access and quality to that in their local area, and the built environment as well, and the quality around that. And so that is that's baked into the strategic approach that we have outlined. Some of the complexities of this strategy that it's had to navigate is the changing face of primary care, of course with the integrated care boards, with the advent of the legislation born out of the Health and Social Care Act 2022, and how that has organised primary health care provision and the focus areas around not just dealing with public health issues, but care services more generally, and how that is approached, in particular addressing health inequalities. What we will do as part of this strategy is have a focused action plan. That work is already ongoing to deliver that action plan to complement what is in the strategy. There are a range of outcomes that we want to achieve by 2028, and of course there will be monitoring of the performance of this strategy and the resulting action plan, and that in fairness was a feature of the discussions in the scrutiny committee about how we were going about measuring that. I want to end though by saying this. Of course, a lot of hard work has gone into this health and wellbeing strategy, but we should also remember, and I think it's important on a cross-party basis to say this, we've gone through a very difficult time as a town through the COVID-19 pandemic and the resulting health consequences of that. And what I will say, in the spirit of cross-party working, is it's important to remember those councillors who navigated that situation and the work that Councillor Eugenie Harvey did on health and wellbeing was important during that time. We worked on a cross-party basis to challenge and confront those issues. And I hope, with this approach we set out in the strategy, that we endeavour to arrest the trends that we have seen, not just over the pandemic, but have been born out of years of issues around childhood obesity, substance misuse that is compounding issues in the town. What I want to see is an approach on a cross-party basis where we work to confront these issues head-on. What I've tried to be in this strategy, and what the Council is reflecting, is an honest approach here, because these figures are sobering. I look forward to the questions from councillors, if there are some, and comments. But Chair, this is the strategy. We've really now got to get on and deliver. Thank you.
Thank you, Councillor Charles. Are there any questions? Councillor Durkin?
I've got two, just in case you want to move on. The first one is at the Health and Scrutiny Committee a few weeks ago, one of the Tory councillors made a comment that was recorded and received some public concern about the council paying for a fat club that would be held in public for councillors. As we're 1.8 million in debt and we've got residents living under plastic bags, do you think that is a reasonable recommendation or suggestion?
Thank you, Chair. With the health and wellbeing strategy, as I've said, Councillor Durkin, and I welcome your question, I think it's important to find ways to encourage people to look at ways in which they can live a healthier lifestyle. And I think we should encourage people and incentivise them that way as opposed to other ways of doing that. What we've said in the strategy is clearly physical inactivity is an issue in the town across generations, and I would be for, I think, an approach that we're trying to mirror in the strategy is that actually let's encourage people to think about getting involved in a sports club or other activities where they're getting out, they're being physically active. And so it's about encouragement and incentivising in that way, as opposed to any other ideas that may come up. And that's something that I said at the Scrutiny Committee.
And my second question, which links very much to your response to the first question, as we're in the highest point of the cost of living crisis, how are you expecting people to afford to join gyms and other activities? And certainly at last council we were coming up with some ideas and suggestions about warm places where we could bring people together and we could use that as a health opportunity to enrich people with options and opportunities. And the response we got is that you would deal with it after the budget. But the crisis is now, it's not. We're going to be in a different place in 4 months' time. So I was wondering, what are you doing to incorporate immediate action to address and resolve the issue of cost of living crisis that is affecting everybody within this great town? Thank you.
I think, Councillor Durkin, you raised an important question there, and everyone recognises the challenges born out of the cost of living. What I would say is only today I've put out a separate statement around the support that the council is channeling to vulnerable residences in this town around the cost of living, and I urge you to look at that press statement. What the strategy looks at is ways in which people, during the current backdrop, and we recognise the context that we're in and the current economic outlook, it's not just people going and getting a gym membership. There are other ways people can be physically active, and we're going to look at that. What I want to see as part of the consultation process that will now commence as a result of presenting this strategy is ideas around how we can work with different partners to encourage people to get outdoors and pursue physical activities. There's a range of different opportunities for people to pursue, and at the forefront of my mind is balancing that with affordability, of course. What we're trying to do is say, look, these are the key healthcare issues in the town. These are the key wellbeing issues, and we've got to put forward an action plan to arrest those trends. How we go about doing that, maybe some of the ideas that come out of the consultation process we can take up and factor into the action plan. But I think you raised an important point, and I urge you to look at the press statement I issued today.
Councillor Griggs?
Thank you, Chair. I should possibly at this stage declare a late interest. I didn't realise I was going to ask this question, but I wish to now. And that would be in my position as co-chair of Harlow West District Pride Group. And it would be remiss of me on World AIDS Day not to mention this in relation to this particular item. And that is the group, the Pride Group that I represent, not only is about having a social time and organising a pride event, waving rainbow flags and all the rest of it, we are supplying support services to a number of LGBTQ+ residents across the town. and would very much like, I guess if this is going to be a question, it is, can you ensure that we are including any further consultations on that? I have a number of committee members who would be very happy to contribute and make some very positive contributions to this strategy going forward. Thank you.
Councillor Greggs, of course, issues around LGBTQ plus individuals, the wider community in the town are something that at the forefront of this council's mind, particularly more generally sexual health and wider issues around mental health. You'll be encouraged to learn that in the health and wellbeing strategy, we have made it very clear that we want to see parity between how we treat physical and mental health across the board. So groups like the one you have outlined are important consultees and individuals that we need to engage with going forward to understand if there are particular matters around their own health and wellbeing that need to be brought to the forefront of this type of work. So I'm grateful for that, and my undertaking, and I'm sure officers who work on these matters would be keen to engage with that group as well. So thank you for that.
There being no further questions, we'll come to comments. Councillor Mills.
Thank you. I'm going to morph into Councillor Edwards, who, as I'm able to say this evening, would like, obviously, has been many roles within our board, and obviously, chair of the scrutiny committee. Just make this statement about the process. He's just said, we welcome this as a starting document, particularly statistics which start to lay out some of the issues the town has to address. We now need smart action plans. For one, the council working in partnership with other agencies, and two, for tasks which are obviously council specific.
Any further comments? Come back to Councillor Charles.
Thank you, Chair, and grateful for the questions and the comments that have been shared this evening. The focus now is to implement the strategic focus area of the health and wellbeing strategy, to get the action plan where it needs to be in order to help arrest some of these very sobering trends that we've talked about tonight. That will be the focus. I've also given an undertaking to the scrutiny committee to come back to them at appropriate time to look at where we have arrived in terms of performance on the health and wellbeing strategy. It will probably be an ongoing feature for the scrutiny committee to engage with us on how we're achieving the key outcomes up to 2028, and that will be a focus going forward. So grateful for the points, but I beg to move the report.
We come now to the vote. Agreed.
Agreed.
Which takes us to